Ozempic semaglutide is a prescription medication used primarily for the treatment of type 2 diabetes and weight management in adults. It belongs to a class of drugs called GLP-1 receptor agonists, glucagon-like peptide 1. Here is a detailed overview of patient information related to Ozempic. Indications: type 2 diabetes mellitus, T2DM. Ozempic is used to improve blood sugar control in people with type 2 diabetes when diet and exercise alone are insufficient. It helps to lower blood sugar by increasing insulin secretion when blood sugar is high, reducing glucose production by the liver, slowing gastric emptying to reduce the amount of glucose absorbed from food. Weight management. Ozempic is also used for weight management in overweight or obese individuals, even if they do not have diabetes. It works by reducing appetite, increasing feelings of fullness, helping with weight loss through appetite control and delayed gastric emptying. Mechanism of action. Ozempic mimics the action of GLP-1, a naturally occurring hormone in the body that stimulates insulin release in response to meals, helps lower blood sugar, inhibits glucagon release, which would normally increase blood sugar, slows gastric emptying, making you feel fuller for longer, reduces appetite, which contributes to weight loss. Ozempic is administered as a subcutaneous, under-the-skin injection once a week. It can be injected into the thigh, abdomen, or upper arm. Initial dose: the typical starting dose is 0.25 milligrams once a week for 4 weeks to allow the body to adjust. After this period, the dose is usually increased to 0.5 milligrams once a week. Maintenance dose. After 4 to 8 weeks, the dose can be increased to 1 milligrams per week for better blood sugar control and weight loss. In some cases, your doctor may increase the dose further to 2 milligrams once a week if needed. How to inject. Patients are instructed on how to inject the medication using a pre-filled pen. Ozempic pens come with detailed instructions for self-injection. Like all medications, Ozempic can cause side effects. Some of the most common and serious side effects include nausea and vomiting, especially during the first few weeks of treatment, diarrhea or constipation, abdominal pain, headache, fatigue, pancreatitis, inflammation of the pancreas. Symptoms include severe stomach pain, vomiting, and nausea. Thyroid C-cell tumors, a possible increased risk of thyroid cancer, although this risk is not proven in humans but was observed in animal studies. People with a personal or family history of thyroid cancer, such as medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, should avoid Ozempic. Kidney problems. Ozempic may cause kidney issues in some patients, particularly those who already have kidney disease or are dehydrated. Hypoglycemia, low blood sugar. While Ozempic alone typically does not cause low blood sugar, it can increase the risk of hypoglycemia if combined with other medications that lower blood sugar, e.g., sulfonylureas or insulin. Retinopathy, diabetic eye disease. Rapid lowering of blood sugar may worsen diabetic retinopathy. Allergic reactions. Serious allergic reactions, rash, itching, difficulty breathing, are rare but possible. History of pancreatitis. If you have a history of pancreatitis, you should not use Ozempic. Kidney issues. Those with pre-existing kidney disease should use caution, and kidney function should be monitored during treatment. Pregnancy and breastfeeding. Ozempic is not recommended during pregnancy or breastfeeding. If you are pregnant or planning to become pregnant, talk to your healthcare provider before starting treatment. Children and adolescents. Ozempic is not approved for use in children under 18. Other diabetes medications. If used with other anti-diabetic drugs, particularly insulin or sulfonylureas, there may be an increased risk of hypoglycemia, low blood sugar. Medications that affect gastrointestinal motility. Drugs that affect the stomach or intestines may interfere with Ozempic's effects or side effects. Oral medications. Due to delayed gastric emptying, the absorption of oral medications could be altered. Take oral medications at least 30 minutes before injecting Ozempic to ensure proper absorption. Blood sugar levels. Regular monitoring of blood sugar is essential for patients taking Ozempic, particularly if combined with other anti-diabetic medications. Kidney function. Periodic assessment of kidney function is advised, especially for those with pre-existing kidney issues. Retinal health. Eye exams may be necessary for individuals with diabetes who are using Ozempic, as rapid blood sugar control can affect diabetic retinopathy. Thyroid function. Although thyroid cancer risk has been observed in animal studies, no clear risk has been established in humans. Nonetheless, a thyroid ultrasound may be recommended if you have any family history of thyroid cancer. Blood sugar control. Ozempic effectively lowers blood glucose in people with type 2 diabetes. Weight loss. Many patients experience significant weight loss when taking Ozempic, which can improve overall health and reduce the risk of obesity-related diseases. Cardiovascular benefits. In addition to blood sugar control, studies have shown that Ozempic can help lower the risk of heart attack, stroke, and death from cardiovascular disease in patients with type 2 diabetes. If you miss a dose of Ozempic, take it as soon as you remember, as long as it's within 5 days of your scheduled dose. If it's more than 5 days, skip the missed dose and take your next dose on the regular schedule. Do not take 2 doses at once to make up for a missed dose. Store unopened pens in the refrigerator, 36 degrees to 46 degrees Fahrenheit, or 2 degrees C to 8, do not freeze. Once opened, Ozempic can be kept at room temperature, up to 86 degrees Fahrenheit or 30 to 56 for up to 56 days. Keep it out of direct sunlight and heat. Keep pens away from children. Lifestyle considerations. Diet and exercise. Ozempic should be used in conjunction with a healthy diet and regular physical activity to achieve optimal blood sugar control and weight loss. Hydration. Ensure adequate fluid intake, as dehydration can increase the risk of kidney problems and worsen side effects. Conclusion. Ozempic is an effective medication for managing type 2 diabetes and supporting weight loss. It works by regulating blood sugar and reducing appetite, with additional cardiovascular benefits. However, patients should be aware of potential side effects and risks, particularly with regard to pancreatitis, kidney function, and thyroid health. Regular monitoring, lifestyle changes, and adherence to dosing schedules are important for maximizing the benefits of this medication. Always consult a healthcare provider for personalized advice and to manage any potential risks or interactions.